Most folks may not know that I have a chemistry degree, which is something that not all healthcare leaders have, as well as a degree in philosophy. So I was an athlete, maybe still am to some extent, but was an athlete, played a lot of basketball, played in college, played a little after college. I didn't grow up knowing anything about healthcare administration, and so as someone who liked science, I really thought that medicine was the field for me. And as an athlete, I thought a lot about pursuing a career in orthopedic surgery. And I got exposed to the possibility of a healthcare executive career after college, and got offered a job that I wasn't expecting to be offered, and that was almost 32 years ago. I've had the experience of working in a few places, Texas, California, Michigan. I'm working in basically organizations who are very focused on serving their community, very mission-oriented. This career is really about impact, and it's about my ability to have an impact that I believe is significant. Well, clearly every chair doesn't have the ability to not focus on this one thing, which is critically important, and that is advocating for the financial stability of our field. And so I certainly will have a focus there. I will want us to spend some significant time focusing on workforce, focusing on how we can create, innovative approaches and strategies to provide support to our team members who have, for the last nearly 2 years, been leaning in heavily into a global pandemic. And so clearly that has to be a significant focus of the association. Thirdly, I would say that critical importance to me is innovation. And I think to some extent we need to think about innovation as it relates to the workforce, because we know that with changing consumer demands, we have to be more innovative in how we meet those demands. The last area I would mention, that is making sure that I'm listening intently, and the association is listening intently to the needs of its members. I think that one of the things that's most exciting to me are the innovative partnerships that are emerging. In some cases, as a result of the pandemic, the notion of bringing care more into the community is really exciting for me. Clearly, our ability to bring digital tools to bear to improve the consumer experience, to create more efficiency, to allow folks not to have to leave their homes and neighborhoods to get access to our physicians, our ability to expand things like mental health to a broader population through virtual and other means is wildly exciting. The way that we are now using data in more unique ways to understand how to best provide the care that folks need. The other thing I would say that's really fueling a lot of energy in our organization and across our field and across the country is renewed efforts around diversity, equity, inclusion, and justice. And obviously the AHA has had a significant focus on equity of care for a long time. Henry Ford's been a national leader in equity and diversity for a long time. We've sort of added social justice to our long-standing efforts around diversity, equity, inclusion. And so I'm very excited about the work we're doing there just to create greater community empowerment, to have us focus even more intently on how we invest in the community and how we invest our assets, as well as how do we focus on eliminating disparities within the communities that we serve. It's certainly an honor and a privilege to serve as chair of the AHA board. I look forward to this coming year to help both steward our association in a way that makes sense, to support the AHA leadership. And so, frankly, I would say that while our field has been really challenged in the last couple of years with COVID, there is still so much good that happens in our organizations on a day-to-day basis that there is very much to be both thankful for and excited by in the years coming ahead.